The term you're looking for is likely tracheostomy. A tracheostomy is a surgical procedure that involves creating an opening in the neck to facilitate breathing by inserting a tube into the trachea, windpipe. This procedure is often performed in emergencies or in situations where a person cannot breathe normally due to obstruction or other medical conditions. The hole created in the neck is referred to as a tracheostomy stoma. Tracheostomy is a surgical procedure that involves creating an opening in the neck to access the trachea windpipe directly. This procedure is typically performed when a patient has difficulty breathing due to various conditions, such as 1. Obstruction, blockages in the airway from tumors, swelling, or foreign objects. 2. Respiratory failure, conditions that impair breathing, like severe asthma or chronic obstructive pulmonary disease, COPD. 3. Neuromuscular disorders, diseases that weaken the muscles involved in breathing. 4. Prolonged mechanical ventilation in cases where a patient requires long-term ventilation support. Duration and maintenance. The tracheostomy can stay in place for varying lengths of time depending on the underlying condition. It can be temporary, days to weeks, or permanent, depending on the patient's needs. Closing a tracheostomy. To close a tracheostomy, a procedure called tracheostomy tube decannulation is performed. This involves the gradual removal of the tracheostomy tube while monitoring the patient's ability to breathe independently. The opening in the neck will then be closed, typically using stitches or leaving it to close on its own. Healing time. The healing time for a tracheostomy stoma can vary. Generally, it can take a few days to a couple of weeks for the stoma to heal completely, depending on factors like the patient's overall health, the presence of infection, and the size of the opening. After the tube is removed, the stoma usually closes within a few days to weeks, but some patients may require additional care or interventions for proper closure.